Hi class, I wanted to put together a very short, brief presentation on dental hygiene diagnosis, also known as DHD. I'm sure you have been, introduced to this in the past, but I just wanted to make sure we are all on the same page. The DHD is what we call a statement, and we will be implementing this in the summer semester, and it will be implemented into your notes in Origin. So DHDs, the purpose of it is that it allows us as hygienists to create a treatment plan based on the patient's needs, and we can set goals for each patient. This helps us educate the patient. We can measure outcomes, which is extremely important, and we can improve the overall health of our patients. This allows us to individualize our treatment for every single patient. And how we do this is through a process, as we're all very familiar with, is ADPIDE. So we're always going to start with our assessment, which is our data collection, which is objective. We're going to collect the information on what we see clinically and objectively. And from that data collection, we can identify what the problems are for this patient, and then we can help plan to figure out what kind of intervention does this patient need, and then we can implement the plan, and then we're going to evaluate the effectiveness of the plan, and of course, as always, we're going to document everything in the patient's chart. So the whole thing with a dental hygiene diagnosis is, like I said, it helps us identify the patient's actual or potential health issues, and that we can help intervene and individualize the treatment for this patient. Now, the dental hygiene diagnosis is different from the dentist diagnosis, and that's really important to understand. The dental diagnosis is the dentist comes in, he's going to obviously take a look, or she's going to take a look at the clinical and radiographic information, and they're going to identify if there's any cavities, any fractures. They do diagnose periodontal disease, and then the dental hygienist, we identify any risk factors or any behaviors that is basically causing this. And between the dentist and the hygienist, we close that loop and we are able to treat the patient as a whole. Basically, the dentist takes care of the teeth in a sense, and then as hygienists, we take care of the gum tissue. And we bridge those two together, and now we are treating the patient as a whole. So when it comes to the DHD, there are components that we need to be familiar with. So we need to identify the problem or the cause or the contributing factor, and then we have to identify the evidence and the signs and symptoms. So there are 8 human needs that we need to recognize in order for us to put a DHD together. There are 8 human needs, and that is the wholesome of facial image, protection from health risks, biologically sound and functional dentition, skin and mucous membrane integrity of the head and neck, freedom from head and neck pain, freedom from anxiety and stress, responsibility of oral health, and the conceptualization and understanding. Now, these 8 human needs need to be met in order for the patient to, to feel good. And if there is a human need that's not being met and there's a deficiency, that is where we come in to determine if there is a deficiency, and then how can we address that deficiency. So this is a chart that I have uploaded in your clinical resources. It's a great chart. You can utilize this in clinic to help guide you on if there is any unmet human need. So you will see that they are labeled 1 through 8, and underneath each human need, there are examples of where this human need may not be met. So for example, look at protection from health risks. If the patient's vital signs are outside of normal limits, the patient would be deficient in the protection from health risks. Take a look at number 5. If the patient presents with gingival inflammation and they have bleeding on probing, or their pocket depths are greater than 4 millimeters, then the human need is deficient in the skin and mucous membrane integrity of the head and neck. Take a look at number 6, biological sound and functional dentition. If the patient is showing signs of disease and maybe there's missing teeth or active decay, or there's abrasion, erosion, or abfraction, well, then this human need would not be met. There would be a deficiency. So you have to take a look at the information that you've collected objectively and determine, are these human needs met or are they unmet? Down here, dental hygiene diagnosis, this allows us, this is a great template that we're going to use to put our dental hygiene statement together. So we have to determine if there is a human need unmet, and if so, what is it? Then we're going to determine the etiology. What is causing that? And then we're going to determine the signs and symptoms. Now, for me, I kind of do this backwards. For whatever reason, it just makes more sense to me. So, for example, I'm already collected all of my data collection, and I noticed that on a clinical level, that the patient has generalized abrasion throughout their entire dentition. So I'm looking at the human needs, and I see that under number 6, biological sound and functional dentition, there's abrasion. So I know that the sign and symptom is abrasion because the sign is I'm seeing some tooth abrasion along the gingival margin. Then I determine, okay, what is causing the abrasion? Well, through talking with my patient and doing my motivational interviewing, I have determined that the patient uses a medium bristle toothbrush and they're using more of, a scrubbing motion with their habits, their technique. So now I know that the sign is abrasion. I already know that by talking to the patient that it's from improper brushing technique, and the unmet need is going to be the biological sound and functional dentition. So how I would write this would be as biologically sound and functional dentition due to improper brushing technique and using a medium bristle toothbrush as evidenced by abrasion. Then I go down here to client goals. So what is going to be the goals of my patient? Like, what is the expected outcome? Well, the expected outcome is that I will demonstrate the proper technique of brushing for my patient and recommend a soft bristle toothbrush. Another goal would be is that the patient would be able to verbalize back to me that they understand, and they would demonstrate the technique of proper brushing that I have just showed them. And then the evaluation part of it would be is when I see them in 6 months, I would talk to them about it to see how they're doing with their technique. So this chart kind of guides you through that process. So let's take a little bit closer look at this. So this is going to be the template that we're going to be putting in Origin under dental hygiene statement. So everything in the parentheses is what you're going to add in. So you're going to determine what the unmet human need is, what is the etiology, what is the signs and symptoms, and then what are your expected outcomes. So let's look at a couple of examples. So this patient comes in and I'm seeing some generalized 5 to 6 millimeter pockets and some radiographic bone loss. Okay, so those are my signs and my symptoms, right? Now I have to figure out why. Well, for me, it's because the patient stated that they use tobacco and they just have not been consistent with their periodontal maintenance. And I look on my chart and I realize that it's protection from health risks. So this is my statement. So protection from health risks due to tobacco use and inconsistent periodontal maintenance as evidenced by generalized 5 to 6 millimeter pocket depths with radiographic bone loss. And then I have to determine the expected outcomes. The patient will verbalize the understanding of tobacco effects on oral health. Patient will reduce daily tobacco use within 1 month. Periodontal condition will stabilize at evaluation. Now, here's a couple things to make sure to understand about the expected outcomes. We need something measurable. Now, if you see here, the patient told me that they will reduce their tobacco use within 1 month. That 1 month, that number allows me to have, it's a measurable outcome, meaning that the patient tells me that they're going to reduce this within 1 month. The other thing about expected outcomes is it's expected, okay? That doesn't mean it's going to happen, right? This is what we would like to see happen, hope it happens, but it may not happen. All right, let's take a look at the next one. Skin and mucous membrane integrity of the head and neck due to biofilm accumulation as evidenced by erythematous gingiva, edema, and bleeding on probing. The expected outcome is that the gingival tissues will appear pink and firm within 6 weeks. Again, measurable, 6 weeks. Probing, bleeding on probing will be reduced at the periodontal evaluation appointment, and the patient will maintain improved oral hygiene habits. So again, this would tell me that the patient presented with red gum tissue, that there was some bleeding on probing and inflammation. Okay, why did this happen? This is happening because the patient has, biofilm accumulation, and that would make that the skin and mucous membrane integrity of the head and neck is deficient. What we want to see happen is we want the gum tissues to be healthier. We want them to be more pink. We don't want any more bleeding on probing, and we want the patient to improve their oral health. Let's look at one more. Okay, responsibility of oral health. This one is very common that we're going to see. So, responsibility of oral health due to ineffective oral self-care related to inadequate brushing and flossing techniques, as evidenced by generalized plaque accumulation, there's supragingival calculus, and there's bleeding on probing. The expected outcome is that the patient will demonstrate proper brushing and technique by the end of the appointment, and that the patient will reduce their PI score from 80% to 30% within 4 weeks. Gingival bleeding will decrease within 3 months. Again, measurable. The patient is going to reduce the biofilm from 80 to 30% within 4 weeks. Or maybe it's by the next appointment that you see the patient. So we want something to show, is this patient improving? Are they staying the same? Or again, are they regressing? For the dental hygiene diagnosis, it is part of our care that we provide our patients. Again, please always utilize evidence-based information. Nothing is subjective. We have to be in the position of being able to prove to the patient what is going on in their mouth and what are we going to do as hygienists to help that patient. Now, the good news is as technology gets more advanced and more offices adopted, AI is coming involved. And AI is really going to be able to take this to the next step and be able to show patients, yes, in fact, you are grinding, or yes, we are seeing more recession. And then that way we can hopefully be able to document this a little bit more accurately with AI. So take this information, find a way to individualize the treatment for your patient, and find at least one or two unmet human needs for that patient, and find a way to measure your expectations of that patient. And I hope this has helped. Please know that we are here to help guide you. I know that this might be new to you, and this is something that we can kind of critically think with you on each patient, and we'll start individualizing the treatment for every single patient. Thank you so much.